welcome. Come on in. I'm Dr. Glenna Rice, and this is Energetic Manual Therapy, EMT. So what is energetic manual therapy? So energetic manual therapy is a specialty class with access consciousness that I have created over the many years I've been doing access, and many years, I mean like 20. Before that, I was trained as a physical therapist. Went to a great school, did really cool stuff, started this myofascial work, trained in that. So fascia is a big part of energetic manual therapy. If you don't know what fascia is, I can tell you everything about it in class. So I started this fascia work and loved it, just loved it. The results I was getting with my patients were phenomenal. You know, I worked on my family and friends first, and then everyone was, and I'm like, after my 5th or 6th workshop, I'm like, this is it. I'm starting a practice. So I have a patient who I'd seen for a while, and she was into weird stuff. So I'm like, I just did all this new work. I just did all this. Can I try? And she's like, yeah. So I'm working on her doing fascial work, doing this really cool myofascial release work I've been doing for a few years. And I add this access stuff in, and I'm working on her fascia, and her body just goes under my hands. And we both were like, oh, whoa, did you feel that? Did you feel that? So that was probably the first moment EMT started. So fascia, what is fascia? Fascia is the connective tissue of your body. It's everywhere, it's everything. It's basically your body with cell, and all the other cells are kind of floating around, suspended and covered. Fascia goes through them. All the other cells of your body are surrounded by fascia. So it's your body. There's not a part of your body that's not there. I love this description. If you took every cell in your body and just got rid of all the other cells and just left your fascial connective network, this spider web structures, your tendons, ligaments, it's everything that's a connective tissue. You just left that, got rid of everything else, you would look the same. You'd be translucent. Your whole shape and form would exist, but you'd be translucent like a jellyfish. It supports your body and it gives it its shape and form that we see all the time. It is so strong that you cannot stretch it. The coolest thing about fascia, and this is where the access comes in, is fascia responds to a question. You cannot stretch it and change it with the force of your hands, but you can invite it to completely change its shape and form. And how do you do that? That's what this class is about. How do you ask your body to change? And what's access about? You know, being a question, changing, contribution, question, choice, possibilities. So when I started integrating the tools from access into this work, it really became an access. What I do in the EMT class is we learn how to access fascia with our hands, so manual, and the energetics of the body whispering. The energetics are all the energies of the body, of you, and what you contribute, what you know, and how you access energies to contribute to the change people are asking, or the body is asking for. And therapy is kind of a cool word. It actually means to care for and nurture people. It's an old Greek word, and that's its root. So we are caring for, nurturing with generative, kind energies when we bodies. The thing about fascia and the thing about our lives is you can't force them. You cannot force fascia to change. It will resist. It's designed to resist deformation forces. That's its job. That's what it does. If you try to force it, it will fight you. Just like if you try to force me to do something I don't want to do, I'll fight you. Just like if I tried to force you guys to do something you didn't want to do, you'd fight. That's what happens. You try to force someone, the barriers come up. Fascia does the same thing. So the class is you becoming aware of how you invite. And it's very easy to invite fascia to change. We see miracles. I see miracles. And they're not miracles. Miracles become normal when you do this work with bodies.